TB is probably the most neglected diseases. Over years, people had the impression that we are done with TB. The danger of not knowing TB is an issue is that it's a delayed diagnosis. People don't see people with TB, and the funding and the awareness are going hand in hand.
2 to 3 million people are left behind without diagnosis and treatment for TB. What we need to do is to reach out to the community, screen for TB, and get TB diagnosed early before it spreads to others.
My name is Lucica Ditiu. I'm the Executive Director of the Stop TB Partnership. Stop TB Partnership was created in the year 2000 by the World Health Assemblies. Ministers of Health decided that there needs to be a structure to fight TB that brings all the partners together. And what inspired it was there was a moment of silence around TB when people thought, oh, we got rid of it. And then in 1992 to 2000, a big spike in most of the countries, including in US. So ministers came together and said, we need to fight TB, but TB is not just a medical disease, it also has social aspects. So let's come together with the idea that there is not one that can lead this fight. TB is the biggest infectious disease killer, and it persisted with us for so many years. India, Indonesia, Philippines, Nigeria, Bangladesh, Pakistan, high-burden countries in which their leaders are pushing that everybody with TB is diagnosed and treated. The moment you diagnose and treat everyone with TB, you don't have people dying unnecessarily and you stop transmission. Science says that from the people infected with TB, 20% will develop the disease within their lifetime. Countries are going to levels in which the gap between how many are estimated to be sick and how many are diagnosed is closing.
Nigeria is the first in terms of burden in Africa and the sixth globally. Awareness of the disease burden was very weak. So we felt, okay, the first we should do is to create awareness, which is the first principle of prevention. One unintervened case of tuberculosis has the capacity to multiply to 15 people in a year. So all we needed to do was fish out those missing cases, place them on treatment, retain them in care, as that's a sure way of cutting the chain of transmission. We came up with the principle of keke napep, in which you put everything, the diagnostic, the chest x-ray, with artificial intelligence, take it to those hard-to-reach areas, and they're getting very good results. Most of the innovations we see were all piloted, through the support of Stop TB Partnership, USAID. The global Stop TB Partnership have, been of very tremendous support to us in Nigeria, led by Dr. Lucica Ditiu. Part of their mandate is to raise advocacy for resource mobilization and also to support, the countries that are doing very well. In all, the Stop TB Partnership Global has been of tremendous support to what we are achieving in Nigeria today in terms of ending tuberculosis. Communities are key for any intervention because it will help us address a lot of issues: stigma, discrimination, activating the community structure, expanding our laboratory network, and of course placing them on treatment.
My name is Fatima Ramadan from Uke Karo local government. How I got TB was the year 2022. I was enrolling for admission into university, but unfortunately, due to the disease, I couldn't get the admission. I was coughing for a week. Before then, there is someone in our house living with TB, which all of us don't know. She has been coughing for a while and have been sick. We thought it was just normal common cold. The doctor did all his best. He was like, okay, you have TB. The challenges I faced, it was the stigmatization and financial problem. I was isolated from some of my friends and family. There was a time that I was even asked not to sleep with my children. And Coming down to the drugs, the first day I took the drugs, I was not on myself, but few days later, my body system have to adjust with it. TB is not a deadly disease. Just because you have TB does not mean that that is the end of the world. You have the right to go and look for drugs. If you are not convenient with the drugs, you can ask questions. And these drugs are just for free and they are not harmful. Your health is your main concern.
For the Philippines, we've been doing many steps and covering all corners to be able to increase our testing. Very important, the first step was the utilization of our fixed X-ray machines. The second one is what we call the ultra-portable X-ray with artificial intelligence, and take X-rays of a community that's far away from fixed X-rays.
So the ultra-portable X-ray, which are enabled by AI, are diagnostics that you can take anywhere, and it works on AI, so you don't need a radiologist on site to give the results. This is a technology which can go to every corner of the world. There should be no reason why in the remotest part of the world we are not able to deploy this technology and use it. And coupled with that are these molecular tests, which are also battery powered, which can be deployed to confirm the diagnosis after the X-ray screen. So this is something that Stop TB Partnership has been working, and we are very happy to be associated with a lot of work in this area. In fact, when we started it all some years ago, people said this is science fiction. But what I wanted to highlight is to really scale it up, we need funding. And we have also highlighted from Stop TB Partnership that the global fight against TB is underfunded. We need all of the government and all of a society approach. And all of that is possible if the leaders get involved. This is where we are trying to now put a lot of efforts. How do we mobilize the heads of states and heads of governments to lead the fight? In the UN General Assembly, countries committed that $22 billion will be mobilized every year for TB care and prevention. Currently, less than 6 billion is available. So we need to do more on reducing this funding gap.
If we don't have the resources, if all these efforts are not leading to increasing the attention of the political leaders, of the governments on dealing with TB in their own countries related to their burden, if we don't achieve that and we don't achieve the funding, we can be, crying and yelling as much as we can, but we will not arrive anywhere. I am infected with tuberculosis, and I was not infected with TB, and suddenly for a World TB Day, we decided to do a test, all of us, and I came back positive together with 5 or 6 colleagues from Stop TB. I come from Romania, but I live in Switzerland, so I'm not living in a country where you meet people with TB. So we don't know where I was infected, but I was infected. So the shock was the reaction of my friends. And even though I thought they are not only well educated, but because me telling them the stories about TB and how it works, they learned something. It was so ridiculous because we were having a party. I told people, I am infected with TB. And the host actually came to me and said, maybe you don't come to the party because you never know and maybe you spread something. It's clear the level of misunderstanding, the level of stigma, the level of isolation that people with TB go through is huge. For people with TB, as well as people working to address TB, is not easy. But we cannot give up. We cannot give up because we are the only hope for many people with TB, and we are the only defenders of them. And there are so many voiceless people that need us. So irrespective of the challenges that we will face, irrespective of the discouragement, irrespective of the fact that we will be pushed away and other things will always be more important, we have to come back. We have to come back, and we cannot ever give up. Never give up. That's what I want to say.